Yeah, it feels good that I know that I'm going to be helping people for sure.
Yeah.
Sharing my story, I know for sure, because I there was a time where I didn't want to give it another chance at all.
Yeah.
Welcome, Anthea, one of my former patients. I was just commenting that, wow, like what a difference from when I first met you.
A major difference.
It's a huge difference, and I don't think I would have recognized you if I just saw you walking down the street.
Right. Yeah.
Yeah. So you've done amazing.
Yeah, thank you.
Mm-hmm.
Thank you so much.
Absolutely.
My journey started, for the positive, is when I got on the Sublocade shot.
Was it?
Like, that turned my whole life around. Like, I wasn't a ball and chain to the pharmacy anymore.
Right.
You know?
Right.
And that was like a major freedom, along with I can get a normal job. I can be a normal person, right?
Yeah.
Fit in society. It's like, wow.
Right.
I can never stop saying thank you to even the research. Then the whoever came up with the Sublocade shot was just it's amazing.
Yeah.
Saves lives.
I'm glad it worked for you.
Yeah.
And
it took me 3 times though. Three times.
Which is fair. You know, like it doesn't always happen on the first time. But
no, I was scared to do it again because I didn't want to get put in withdrawal again.
That's right.
But that's why I tried, and you convinced me to try it.
Well, I've been known to do that. But let's take a moment and rewind a little bit. I want to take you to a couple points in your life, if I can, just to kind of really understand your story. Let's talk about when you were in the downtown east side, sort of when things were at their worst.
Yeah.
What was life like for you then?
Horrifying. It was like living from day to day. Like knowing that when you wake up, you're going to have to find money to make you feel better. Like you're going to wake up sick, and always to make sure that you had enough in your pocket to keep going, so you won't be sick, is a horrible way to live. Luckily, I had a family that supported me. Like my mom didn't want me ending up on downtown east side, so unfortunately, I kind of was in and out of there. I never ended up on the street down there.
So at that time, you were using fentanyl.
Yeah.
Were you using methamphetamine as well?
A little bit, dabbling in it.
Dabbling in methamphetamine.
Yeah.
And walk me through a typical day. You sort of when things weren't going well for you. You would wake up and.
Typical day would be begging dealers to front me.
So I really want to understand what your life looked like. So you're sleeping where?
I would be bouncing around probably.
Like couch surfing, or were you on the streets? Or?
Well, I wasn't allowed to stay at my mom's at that time because I was asking for money.
Yeah, of course.
So she usually set me up in a hotel where a lot of her money is gone, which is becoming, like now later on in life, it's becoming prevalent that there's a problem with her finances because of my drug use, which is hard.
Well, she did what she felt she had
she did what she could, but she's going to have to sell her place right now.
Okay.
And that's not a nice feeling, but anyway.
So she would put you up in hotels.
Yeah.
And then you'd wait. Is this sort of downtown or different places?
2400 or the Best Western, Cassandra. Like the mediocre hotels.
Okay. And then you'd wake up and
call the dealer. And when my money ran out, then I'd be stealing or, just hooking up with somebody who has drugs. Yeah. It's not a nice way to live.
I can't imagine. And how much were you spending a day on drugs?
Like about $100 a day.
$100 a day. Yeah. Which is pretty much the average that I hear is about $100 a day. So you would get enough to use for the day. Were you smoking or injecting at this time?
I went through smoking it, and then I went through injecting it, and then realizing I didn't want to poke my body anymore and have marks, so I went back to smoking it again. Yeah.
And that's kind of the pattern that I've seen as well with fentanyl. It's just you end up using so frequently that you blow out your veins, essentially. Yeah. People just resort to smoking. Okay, so it sounds like a difficult... And were you experiencing psychosis with the stimulant use?
Yeah, I had, because crack cocaine was in the picture too.
Yeah.
So, staying up for days, maybe even weeks, was scary.
Yeah, and then what would happen?
Then you start hearing things, seeing things, and
Yeah. But this wasn't always your life.
No. I was on the BC soccer team.
Where'd you grow up? You grew up in your UBC?
Yeah, I grew up on 32nd and McDonald. So.
Yeah, so like a great neighborhood.
Yeah,
just
neighborhood.
around the corner from here.
Yeah.
And
beautiful life. I had a great life.
Paint me a picture of just your life, your childhood.
I had a great childhood. I was riding horses down in Southlands with a friend, camping, soccer. School was great. I was on basketball, volleyball, every sport there was to be on, I was on.
Your dad was a professor at UBC?
Yeah.
What did your mom do?
She taught microsurgery at Jack Bell Research Center.
Oh, wow, that's right. Okay.
Yeah.
Okay.
So I was supposed to be a brain surgeon, but I was a hairdresser.
Okay. A life that many people would wish for their children, right?
Yeah,
would dream of, yeah. And so where did things, like you were saying, where did things turn for you?
When I broke my knee, when I did my anterior cruciate ligament.
Was that playing
soccer?
Soccer, okay.
Yeah, and I have a lot of energy, like I have ADD, so it's hard for me to sit still. That's why I was in a lot of sports. My dad put me in a lot of sports and it cured the problem, right? But then when I broke my knee, I found I couldn't move around it. It was like hellish. I was like bound to this knee brace for 6 months. Now they have it in and out of surgery in like a couple days, arthroscopic surgery, but I missed it by one, I think 1991.
Oh, I see.
The next year, one. Yeah, so that was crappy, but so yeah, it was hard for me to watch the Canadian women's national team play, and it was and that's when the cocaine came in the picture, because it was like, okay, I can still get my adrenaline rush like on the couch. You know, as soon as I tried it, I loved it. I'm like, okay, I landed. This is for me. It calmed me down. Like,
calmed you down, yeah.
Instead of hyping me up. Yeah. I used to use it to study.
Is that right?
Yeah.
So you had proper ADHD.
Yeah.
You know, I see that with kids with ADHD. It's just neurobiologically they just need more stimulation, right? So you can get that in different ways. You had it through sports activity, being active, riding horses, but then like you're saying, when that was taken away, it was replaced by chemical stimulation, I guess. Yeah, exactly. Okay, so you're doing cocaine, it feels good, you're still living at home, and then what happened? A long time ago. Graduated in 1991, so high school was great. Like I was like it didn't get out of hand really till after high school, because I kept my grades up and all that. I did have a problem with the principal with skipping school. I'm a Dr. Hunt, so he kicked me out of PW, which was upsetting, but I went to Kitsilano, finished at Kitsilano, and then graduated in 91, and then I kept with the same boyfriend, which is not good, but he had a nice bike. Let's quickly go back to the skipping school and stuff. What did you find yourself sort of gravitating towards a certain group of kids in school? What was that all about?
I guess when I sort of got out of touch with my soccer, like being like every day was soccer, I found the smoking crowd, you know, they're kind of like the badass crowd. And I thought, okay, well, they're kind of like a new kind of high, just hanging out with them.
Right. That kind of takes me to this part of that ADHD sort of spectrum, personality traits, where like there's some novelty seeking or risk tolerance, where you're sort of maybe attracted to things that are a little bit more risky. You know, they produce a little bit more dopamine release when you participate in those activities, and part of that could be a more risky group.
That's right. Yeah.
Okay, so they're smoking and they're kind of badass, and that seemed appealing to you. Sounds like those types of things, higher risk things in life, were more appealing to you. The motorcycle, the guy with the motorcycle. A lot of kids would be afraid to get on the back of that bike, but you probably found it thrilling.
Yeah, the faster the better.
Right. Yeah. I get that. So kind of gravitating towards, lost what was super meaningful to you, which was the soccer. Because you were on the BC team, you were saying. So that's pretty much as high level as
just right under the national team.
Yeah. And
like I was going for national. If my knee didn't give out, I probably would have been with.
Yeah. And that was probably was that a big part of your identity?
The big identity. Yeah, everybody knew me as a big soccer player.
And suddenly that's taken away.
Yeah, that was it was a crush.
You were crushed. Yeah.
Yeah, my dad was really crushed too. He started drinking more.
When you lost soccer.
Yeah, he did.
Interesting.
He was my scout, like you said, like the soccer manager, sort of like.
It's part of his identity as well.
Yeah.
Did you feel like you'd let him down?
A bit, yeah.
Okay.
Yeah, I did. I took a medical office diploma course because I wanted to make my dad proud of me, right? But I realized, and then that lasted for a week and a half because I hated being 9 to 5 behind a desk, not moving behind a desk. So I like the outdoors and stuff.
But the first time you did opioids?
No, I don't really.
Okay. How did you end up using fentanyl?
Okay, that's because the heroin ran out. Like,
so you were using heroin?
Yeah, I was using real heroin. And back in the day, it was real heroin.
Got you. Because you were,
And that's what Did
you start using heroin, or was it prescription opioids first?
Oh no, it was I reached out for heroin.
Yeah.
Yeah.
Was that through a boyfriend or?
A friend of mine. Yeah.
A friend?
Yeah.
Yeah.
He used to deal it. Yeah.
Okay. What was appealing about heroin, do you think?
It was a way to calm down and escape the world.
Okay.
Yeah.
Escaping,
failures that I had, my failures. Letting my dad down. Stuff is a big one, right? But, I mean, he'd be proud of me today.
Yeah, he sure would.
The last thing he told me was to persevere, right? That's his last words to me.
Is that right?
Yeah. So.
Okay. Well, you did.
Yeah.
You sure did.
Yeah.
Okay, so you started using heroin. Mm-hmm. And how quickly did you get addicted to it?
Oh, like instantly.
Yeah?
Yeah.
Do you remember the first time you used it?
Yeah.
What was that like?
Yeah, I loved it. I was at the beach, and we ended up passing out at the beach and waking up in the morning and doing more. And yeah.
Okay.
Yeah. I remember when heroin crossed over to fentanyl. Mm-hmm. I remember the slow transition where you couldn't find heroin anymore. Mm-hmm. That was not something that I wanted. Like I would ask for, right? It was something that just sort of happened. Mm-hmm. Like the whole stream of like downtown slowly got flooded with like the heroin gone and the fentanyl.
Yeah, I remember
prevalent.
That. I've been doing this long enough where I remember when that happened, and just like you're saying, like people didn't want to be using fentanyl. First they didn't know they were using fentanyl.
Right. Yeah.
Right? You remember that?
Yeah.
And then they realized, okay, it's there, but they didn't want it. And then next thing you know, there was no heroin.
Right. Yeah.
Yeah.
Yeah. It's crazy.
Do you remember how fentanyl was different than heroin for you?
Fentanyl, yeah. I remember it seemed to run out shorter.
So it didn't last as long?
A lot shorter. Yeah.
Okay. What was the high? Was the high different?
The high was like faster, more intense, and it would pass you out, like it would knock you down instead of like heroin just kind of put you to sleep and you relax. But like fentanyl would like take your, like you'd fall down, like you pass out, like a horse tranquilizer or something.
It's pretty strong, yeah. It's like 50 times stronger than heroin.
It's crazy. I remember like falling down, banging my head 1,000,000 times.
Yeah, you had overdoses, huh?
Pardon me?
You had overdoses.
Yeah, I didn't know those were like overdoses. I thought that was just a regular way of using fentanyl.
Yeah.
Honestly.
Yeah.
Which is scary when I think back about it.
Yeah. What about the withdrawal, heroin compared to fentanyl?
I thought the fentanyl was way worse. Withdrawal. Yeah.
Okay, so now you're using heroin or fentanyl, and you're in and out of the downtown east side. You're living in hotels, and talk about do you remember when you came to the hospital when we met?
Yeah.
What was going on then? Do you remember?
I think I was in psychosis. Yeah. I think every time I did go to the hospital, I was in psychosis. Yeah, some sort of psychosis. But I've always wanted to try to get off of this fentanyl. Yeah,
like your motivation was there. And I feel like most people that I can't speak for most people, but from my experience, the patients that I treat who use fentanyl, they don't want to be using fentanyl. They don't want to be living in the situation that they're living in, right?
Right.
Nobody wants to be homeless, living in the streets of downtown East Side or in and out of SROs. It's a difficult life. Nobody wants to be hustling to make it that $100 a day to use. It's not an easy life.
No. Where I'm living right now is the Belkin House, which is the Salvation Army, which is great. Like, it's nice to get your own little room with everything you need and shower. And people are great there, and counselors are great. But you stay there for 2 years, up to 2 years, and they move someone. They help you move on and find housing. So I'm there right now, but my neighbor died, and she was 25.
Was it an overdose?
Yeah, right next door to me, just so close to home. And then 2 other people.
Wow.
Just right close in the same building as me.
That's rough.
That I knew, right?
Yeah.
That I've been having coffee every morning with. And
you've had a lot of loss.
Yeah, a lot. Yeah. And so I'm thinking, this is like not me. I need I need next chapter to my life, which will be a beginning, a new beginning, which will be a clean beginning, which will make my dad proud and everybody else proud of me. Right?
Yeah.
That's what I need, right? So I'm going to give it one last chance. That was the one last chance.
When you came in?
When I came in.
And at that time, I think what you had told me was you had tried buprenorphine, but it had put you into withdrawal.
Oh, yeah.
Is that right? Yeah.
It put me in withdrawal a couple times.
A couple times. You had a couple tries at it and put you into withdrawal.
And that's why I was scared to do it again, because the withdrawal is so painful. Like, I can't explain it.
So you experienced what we would call precipitated opioid withdrawal.
Oh, yeah.
Tell us what that's like.
Oh, it's horrifying. It's like bugs are crawling all over you. It feels like somebody from the inside is trying to scratch their way out of from inside you, and you can't sit still. Like, you're moving, you're constantly moving and kicking and moving to stop the pain. You can't sit still.
Pain all over.
Still.
Yeah.
Yeah, and what else? Like, your hair stands on end. Hot and cold sweats.
Vomiting?
Geez, everything.
Vomiting?
Oh, yeah. Throwing up and diarrhea, too.
Yeah, at the same time.
Both ends. Coming out both ends.
Yeah.
At the same time.
At the same time,
It's horrifying.
I've seen it. And people talk about pain all over.
Like, somebody's taking a bat to your back as well. Yeah. So, like, if I was experiencing that pain and I knew I couldn't get out of it, and there's a gun near me, I would use it. And I'm sure a lot of people would too. They knew they couldn't get out of that pain.
That's right.
Yeah.
Yeah. It's. I've seen it, and it looks excruciating. Oh
yeah. Like, I'm not one on like giving people money that are on the streets and stuff, because I know they're just gonna go buy drugs. But I see girls like my age or younger, and I just feel so bad for them, right? And they're like crying, they're in pain, and they need it. And I'm like, here's $20.
I see. Just to get out of the withdrawal.
Yeah.
So I understood your reluctance to get onto buprenorphine, right? It's not the only medication we have, but it's one that I thought would have worked well for you. So it took some convincing, and I think this is where some of our research fits in, because we'd come up with ways of getting people onto buprenorphine quickly without the need for them to go into withdrawal. And without the risk of precipitated withdrawal.
Yeah, because when I what is that word? When I changed over, right, from onto the Supplicate shot, I didn't feel any pain this last time. Yeah, I don't remember being in pain.
Yeah. Did we do it through I don't remember. Did we do it with the patches, or did we just I know we low dose induced you.
I can't remember.
Yeah, I think we did the patches. And I'll never forget, because you were not very hopeful that it was going to work.
No.
And it took a lot of convincing, and I spoke to your mom as well.
Yeah. Because, she would say that, no, she's not going to want to do it, right?
Yeah.
Because a bunch of times before I was, put in so much pain and it's like not changing, right?
Yeah.
I could not change, my body could not change over to the shot. I don't know why. But anyway.
So this time around, you decided to go for it. Yeah. And you got on to buprenorphine, and we gave you the extended release injection, which lasts a month at a time. And then what happened?
Wow, just a sense of freedom. I was just so happy. And everything just started falling into place, it's
great to hear this from you, because one of the things, it's a myth that I often hear I hear it from patients, people who use. I hear it from physicians, addiction medicine physicians, that, oh, this person uses fentanyl, so buprenorphine won't be enough for them. Or the extended release injection is not going to work for them. Or I've even heard the argument that it's not ethical to give people who use fentanyl the injection because it will get in the way of them being able to use fentanyl, which seems kind of bizarre. But
that's a strange one.
That's a strange one. But you're an example of many of my patients who've done very well on buprenorphine, particularly. I'd like the shot, the extended release formulation, because then I know that my patient is protected for a month at a time.
Yeah.
And then you're not stuck having to go to the pharmacy every day to get your dose, etc.
Yeah, exactly. Yeah, for sure. Yeah. I think it's a godsend.
I'm glad it worked for you. One of the things that I found just an unusual experience was, at some point when I first started treating you, I realized that I think you told me that your father was my university physiology professor. Yeah. And I remember him very well.
Yeah. Everybody can remember him very well.
He was very distinct.
Big mustache, the British, sense of humor, like John Cleese.
That's right. That's right. So that was an unusual experience for me, because now I'm treating sort of one of my mentors and professor's daughter. Sort of found out halfway through our interview that that was the case.
Oh yeah.
So then then we also had to treat the psychosis. We can't treat one without the other, so we had to do that as well. Do you remember what happened after your treatment in hospital? Did you go back home or with your mom?
I went back home for a while. Yeah. And then I went to New Dawn.
Okay. Treatment program,
to keep myself, busy and stable and doing the right thing. I went there, and then from there, I think I went to Balkan House. I've been at Balkan House for a year now. Yeah, and I got my traffic control
did you?
license. Yeah, it's good money. It's outdoors. So it's outdoors, and it's good money.
I can see you liking that job.
Yeah, absolutely. So gonna do that. I got my first aid as well, and they paid for that as well, which is good. And I got the uniform, so I'm all ready to go, and I've got a job lined up. So and my driver's license I got back because I got it taken away because I fell asleep behind the wheel. Okay. It wasn't good, but.
Pulling your life together, because I remember, I was always curious how you did. Yeah. So I remember calling your mom like a month after you were discharged from hospital, and she told me you were in New Dawn, I think.
Yeah, cool. Yeah.
Yeah, I was like, okay, so she's doing okay.
Can I ask you a question? Animal tranquilizers, that's shown up in a lot of my blood too. Like
in the past.
In the past, yeah. What is that? What's that about? Is that hard to get people off? Just wondering.
Yeah, I mean, so animal tranquilizer is a general term, but there's a number of adulterants that are added to fentanyl. Many of them are veterinary medications. Wow. They're not approved for people. So
freaky.
One of the first ones that we saw was carfentanil, which is used for like large game.
Oh wow.
And it's an order of magnitude more powerful than fentanyl.
No wonder people are falling down.
Oh yeah. Like, and then
crazy.
Absolutely. And then there's different classes of substances. So one of the more recent ones, they're called alpha-2 agonists, but is xylazine and medetomidine, which are also used in veterinary medicine to sedate animals.
Wow,
they're
so freaky to think about.
Isn't it? Yeah.
Like, people don't ask for that.
No.
Oh, wow.
It's been showing up more in BC. And then we talked to a physician out east in Philadelphia who's like one of the more experienced people. And she was saying that basically like at times 25% of the beds in the ICU and the emergency department are occupied by people who are experiencing withdrawal from medetomidine, from that one.
Oh, wow.
So yeah, pretty over there I think even more so, but it's been showing up here too.
Oh, it's crazy.
Yeah. Okay. How have things been with your mom? Relationship with your mom?
Now it's great. But like I say, that finances caught up,
Well, it sounds like you have a lot of guilt about that.
I do, because she wouldn't have to sell her place if it wasn't for what happened with me, right?
Yeah.
She wouldn't be looking at selling, but it's not the end of the world. Like, just get a nicer place, I guess. Mm-hmm. 2 bedroom, and she wants me to live with her, so that's a great thing. That's nice. I didn't think that. I mean, I thought that would take a couple more years for that to patch up that. Mm-hmm. But no, she's seen like me totally. Like, she wants to be with me, and she wants to have dinner with me. She wants to hang out with me. She wants to do things with me. And it's like, wow, okay.
How does that feel?
Great. Yeah.
Was there a time when you didn't feel that?
Yeah.
You didn't think that?
She was like, you can come here. I'll give you $50. You gotta leave in half an hour. And yeah. Sort of deal.
So you got your mom back?
I got my mom back, yeah. And then some, yeah.
And then...
And my son, too.
Oh, okay.
Yeah. So he's a smart guy.
You had your son while you were in the midst of your addiction?
No, I was 36. So that was... I put things down to that was the longest clean time I had, was when I was pregnant with him, actually.
Okay.
Yeah. So he made a difference, right?
Sure.
Yeah. I have a healthy son that wants to be with me and hang out with me.
So you got your son back?
Yeah.
That's cool.
Yeah. And my driver's license and some.
So what is the next
bright future?
Yeah, exactly. And what does that look like for you?
It's just it's bright. It's happy. Like I can do anything I want to do if I put my mind to it, right? Yeah. So and traveling. There's so much to look forward to now. Yeah. Before it was just like trying to, like, not even looking forward to the next day, like not even wanting to wake up.
And before you came in to VGH and we treated you, how long were you using for?
Oh, geez. Okay, I started with my knee, so that was like in high school when it was really bad. So, I graduated in 91. Add 2 years to that. So I've never wanted to do the math, tell you the truth, because I've never wanted to know how long I've been.
But decades.
Decades, yeah.
It's pretty remarkable turnaround.
Yeah. Yeah, my mom was talking with me in the kitchen the other night, and she was like, I can't believe how many years it's been. I didn't think you'd ever get off of it. And she's just reminiscing about things, right? And I was like, yeah, I guess so. Yeah. And she's like, well, you've done it.
Well, you've done it, and you worked hard. Credit to you. You were dedicated, and you made it happen. And like doing stuff like this, you're using your experience to help other people.
Yeah, and that's the only reason why I'm really doing it, is so I can help other people. Yeah. Get over this. Yeah. I think we need to hear these stories. Mm-hmm. That like recovery is possible. Yeah. These medications work, treatment works. Yeah. You can go from decades of use to abstinence if that's the goal. But if we didn't, and some of it does come down to the pharmacology. Like, I think if we didn't have these new protocols to get you onto medication without withdrawal and quickly, may have not happened, right? If your mom wasn't there for you, may have not happened. If you weren't able to get into treatment and second stage housing, it may have not happened. So I think a bunch of things had to come together for you, right? It's a whole big bunch, different pieces put together that make it work. Yeah, for sure.
Sometimes we just minimize it to a pharmacological exercise, like get people on medication, but I don't think that's enough. It's necessary and it's important. Yeah. Probably it'd be difficult to do it without. Yeah. And we do have to be sophisticated in the way we get people onto these medications, so to minimize suffering. Nobody needs to go into withdrawal to get onto buprenorphine, as far as I'm concerned.
Right, yeah.
You don't need prolonged detoxes. You can do it in less than a day. Yeah. Right?
It's amazing. Yeah. Yeah.
But it's not enough.
But it's not,
Typically it's not. I think all those other pieces have to be in place as well.
Sure. Yeah.
I agree with you. I think your dad would be proud of what you've done. Yeah. Right.
Yeah, that's why I persevered, right? That's what he told me to do. It was very important. That was his last words to me, that I did this. Otherwise, who knows where I'd be? I'd probably be dead, right? Like the statistics.
Yeah, I agree.
Yeah.
Amazing. Thank you so much for sharing your experience with me.
You're welcome.
Yeah. Just rest assured that sharing your experience is going to go a long way to help other people.
Yeah, thank goodness, and that's what I want, and I just so that people don't give up, right? Yeah, that's a major thing, because it was a lot of pain that I went through to get onto this, and a lot of trials and tribulations, but you just keep going. It's gonna work. Yeah. If I can do it, then other people can do it.
I think
for
so.
sure. Yeah.